involved in bone growth, the types of fractures that can occur, how bone heals, and the anatomy, the causes, and the treatment of herniated discs. We've just finished talking about endochondral ossification as it occurs in a long bone. So we know that as children get older and we get to the end of the teen years, that the chondroblasts on the epiphyseal plate start to slow down. They don't divide as much. So the plate gets thinner and thinner as the osteoblasts and osteoclasts replace the cartilage with bone. Eventually, the osteoclasts and osteoblasts catch up, and the epiphyseal plate is completely replaced with bone. Now it's called the epiphyseal line. This happens with adults, with males around the age of 21, and with females around the age of 18. So essentially that's when growth stops, or at least interstitial growth stops. So the question is, what controls the growth of bone? And that would be hormones. There are 3 major hormones involved, and the one that's probably most important during childhood is called growth hormone. So again, growth hormone is most important during childhood. And the way that growth hormone works is it stimulates the osteoblasts. So this stimulation causes them to lay down the matrix, which speeds up the growth of bone. 2 other hormones are actually released heavily during puberty, and the first one is called testosterone. Testosterone stimulates osteoblasts also, and in this way helps with bone growth. Now, both males and females release testosterone. It's just that males release a lot more of it, and so that's often why you see a growth spurt in the teen years in males. Another hormone released during puberty is estrogen. And what estrogen does is actually restrains the osteoclasts. So remember that the osteoclasts break down the matrix, and in this case of cartilage, allowing the osteoblasts then to lay down matrix onto the cartilage and resulting in spongy bone. So estrogen slows down the osteoclasts and also enhances the laying down of bone. Both males and females release estrogen. It's just that females release a lot more. So again, all 3 of these hormones play a role in bone growth. So now that we've talked about bone growth, let's talk about some things that can go wrong with bone, which are fractures. A fracture is actually just a break in the bone. And there are many types of fractures. The word that goes in front of, or the word that's used to describe a fracture is an adjective. And there are many adjectives that are used. I'm going to mention just a few of them, but keep in mind that there are many more that can be used that I'm not going to mention. You can also combine some of these. So the first 2 I'm going to mention are called non-displaced and displaced fractures. In non-displaced fractures, the bone ends retain their normal position. So the bone ends retain their normal position. And if you look over here to this picture here, you can see there's a little break right here. It's a little hard to see, but it's right there. This happens to be the tibia and the fibula of your lower leg. So there's a little break here, but you'll notice that the ends of the bone are still in their normal position. The other type is displaced, is when the bone ends are out of normal alignment. And you can see an example of that in this picture right here. So again, we have the tibia and the fibula. Here's your foot, bones of the foot. And you can see the break went across both bones, across the tibia and the fibula. And the end of the tibia isn't even supposed to where it's supposed to be, which is back here. The end of the fibula isn't where it is supposed to be, which is back here. So the ends of the bone are out of alignment. That's displaced. Next two types of fracture are called complete and incomplete. Complete is when the bone is broken all the way through. And you can see in this picture down here, this is an x-ray, that this bone is broken all the way through. Question, would this be considered a displaced or a non-displaced fracture? So we know it's a complete fracture, but would we call it a displaced complete fracture or a non-displaced complete? Well, it looks like the ends of the bone are a little bit out of alignment here, so I think that we would call this a displaced complete fracture. Incomplete, on the other hand, is when the bone is broken but not all the way through. So here's an example of an incomplete fracture. You can see that there's a break right about there, but it doesn't go all the way through. Next two types of fractures are called transverse and linear. In a transverse fracture, the fracture is perpendicular to the long axis of the bone. So in a transverse fracture, this would be transverse. The fracture is perpendicular to the long axis of the bone. Oops, sorry about that. So if we look at this bone right here, this actually happens to be the femur, the upper thigh bone. You can see that the long axis of this bone runs this way, and that the fracture here is perpendicular. That means at a 90-degree angle. So that would be considered a transverse fracture. Now let me ask you, would this be a complete or an incomplete transverse fracture? Well, if you notice, the break goes across the entire length of the bone. So that would be considered a complete transverse fracture. The other type is called a linear fracture, and that is when the fracture is parallel to the long axis of the bone. So fracture is parallel to the long axis of the bone. So keep in mind again that the long axis runs this way, and here you can see that the break is parallel to that. Now let me ask you, would this be considered a displaced or a non-displaced linear fracture? Well, if you take a look at it, the ends of the bone, the ends of the bone are still in their normal position. So we would call it a non-displaced linear fracture. Next two types of fractures are called compact or open and simple or closed. So a compound or open fracture is when the bone penetrates the skin. The bone penetrates the skin. You can see in this picture over here, which is the humerus, that the bone is penetrating the skin. That's a compound fracture. Now let me ask you, would this be considered a displaced or non-displaced compound fracture? Well, remember that displaced is when the ends of the bone are out of alignment. So that is certainly the case here. So we would call that a displaced compound fracture. A simple or closed fracture, on the other hand, is when the bone does not penetrate the skin. And you can see in this picture of the humerus that there is a fracture, but the bone does not penetrate the skin. So it's a simple or closed. So if we take a look at this, is this a complete or an incomplete fracture? Well, it is simple, but it is also a complete fracture because the break goes from one end of the bone to the other. So let's see how these fracture terms are applied. Several years ago, when my son was just about ready to enter kindergarten, he was swinging on a swing in the backyard, and he waited until the swing got as high as it could and jumped off, and he landed on his outstretched hands and then started crying. So we took him to the doctors. They did an x-ray, and when the nurse came back, she said that he had a complete transverse supracondylar fracture of the humerus. So picturing in our head, if we know that the humerus is this upper arm bone, so it's your upper arm bone, and a condyle is a rounded process that sticks out. Supracondylar means above the condyle. So I knew the fracture was somewhere there. Transverse tells us that it is perpendicular to the long axis of the bone. And complete means the fracture goes from one end of the bone to the other, across the entire bone. So when you hear these terms, complete, transverse, supracondylar, you can picture in your head what the fracture must look like. And sure enough, as I was going to the restroom, I happened to pass by the nurse's station where the x-ray was on a light box, and I could see the break, and it looked exactly like that. So again, think of these terms: displaced, non-displaced, linear, transverse, compound, and simple as being adjectives to describe the break in the bone. So now that we know about bone breaking, and we know the structure of bone, and we know how bone grows, what happens when bone heals? How does healing occur? Well, let's take a look for a second at this long bone, and you can see here that there's a break. The first thing that happens is that a tremendous amount of blood seeps through the bone. Remember that bones are very well vascularized, and so when there's a break in the bone, it severs the blood vessels, and you get a buildup of the blood under the skin. That's called a hematoma. So that's the first step. Next, what happens is cartilage fills in the gap where the break occurred. And the type of cartilage that fills it in is fibrocartilage, which, remember, has a lot of collagen in its matrix. And this fibrocartilage forms a bumpy area where it fills in the break. That's called a callus, just like the callus on your hand, which is a raised hard spot. This is called the fibrocartilaginous callus. In about 3 to 4 weeks after the injury, what happens is that osteoclasts come in and start to break down the cartilage, but they leave behind pieces, which osteoblasts then cover with matrix, and it hardens. So you end up with spongy bone. Now, spongy bone in this case is in the middle of the diaphysis, which we know is not where it's supposed to be. So this can't be a permanent condition. But they call this the bony callus. And then from this period on to 2 to 3 months, what happens is the osteoclasts come back and remove the spongy bone, and the osteoblasts lay down compact bone. After this also, you want to kind of shave away the areas here that were bulging out, so we have some bone modeling going on, which is also carried out by the osteoclasts. So how long does it take to heal a bone? Well, it depends on a couple of things. First, it depends on the degree of the direction, the degree or the direction of the fracture. It also depends on the bone involved. Some bones take longer to heal. It depends on the age of the person and their health. In general, it takes about 4 to 8 weeks for a bone to repair in an adult. Some of the most common areas for bone breaks in adults are the wrist, the hip, and the ankle. In elderly people, it can be deadly when they break a hip, not because the fracture itself kills them, but because after they have a fracture, they tend to become very immobile, and and that itself actually leads to an earlier death. In children, bone repair can occur in about 3 to 4 weeks. So children heal a lot faster. Girls sometimes will heal faster than boys because boys are often moving, constantly moving, which doesn't give the bone a chance to heal as quickly. Okay, so we talked a little earlier, we had brought this up in class anyways, about osteoporosis. And osteoporosis is a condition in which bone is removed faster than it is replaced. So in osteoporosis, bone is removed faster than it is replaced. In women after menopause, what happens is that the estrogen level drops. So in postmenopausal women, there's the female symbol. What happens is that the estrogen levels will drop. And so what also happens then is that the calcium levels will drop. And that often will lead to osteoporosis. So you can see above, in the above picture, we've got spongy bone, which is normal, healthy spongy bone, and you can see this area, the lamella, or the hard matrix of the bone, is pretty sturdy. The pores, of course, are normal. This is where the blood vessels or the red marrow exist in living bone. But down here in the osteoporotic bone, you can see that there are little openings or holes within the lamella. So again, what's happening is that bone is being replaced. Spongy bone is typically replaced every 3 to 4 years. But as the osteoclasts and osteoblasts replace it, the osteoclasts break down bone faster than the osteoblasts can replace it. Remember that estrogen restrains or slows down the osteoclasts. So when you don't have it, the osteoclasts speed up, and this is what happens. The most susceptible areas for breaks are in the neck of the femur, which is what happens with a broken hip. What are some of the treatment? Well, there's not a whole lot you can do. You can certainly increase the calcium level that person is taking. Increase the amount of calcium, also vitamin D, because remember that vitamin D allows calcium to be absorbed. You also want to increase weight-bearing exercises, which help increase the density of the bone. And then there is some other treatments, hormone replacement treatments, where the person is taking hormones like estrogen to help replace the bone, help slow down the osteoclast. Okay, one other thing I wanted to mention before we finish up the chapter on bone is a herniated disc. And remember that these structures here are called vertebrae. These are called vertebrae. These are part of the axial skeleton. Between the vertebrae is something called the intervertebral disc. Intervertebral disc. Because, remember, INTER means between. These are discs that are between the vertebrae. Now, these discs, this is another view where this is a superior view now. You can see here's the part of the vertebrae sticking out. Here's the spinal cord right there, some spinal nerves coming out. And here is the intervertebral disc, which is made up of two components. The first component is called the annulus fibrosus. And the annulus fibrosus is essentially fibrocartilage. Now remember, fibrocartilage has lots of collagen in it, in its matrix. And so this is very strong, and it forms the circular structure on the outside, and its job is to hold in the nucleus propulsus. So it holds in the nucleus propulsus. The other component is the nucleus propulsus, and you can see that this is in the inside of the disc, and this is very water rich, so it's got a lot of water in it, and it also contains proteoglycans, which are these carbohydrates. It kind of has the consistency of toothpaste. But the role of this nucleus propulsus is actually as a shock absorber. So remember that every day you put tremendous amount of weight on your trunk, but specifically on your vertebrae. So these intervertebral discs act as shock absorbers to absorb some of the weight. Because the nucleus propulsus has so much water in it, it's able to absorb the shock. And the discs actually at the end of the day are somewhat flattened. So when you go to bed at night, you're a couple of centimeters shorter than you were at the beginning of the day. The other thing, however, is that these discs are forming a joint between the bones, and that joint allows movement. So another thing that the discs do is they allow movement of the vertebral column. Okay, this is the normal function of a disc. So what's going on in a herniated disc is that the annulus fibrosus has torn. So you can see right here the annulus fibrosus is torn, and the nucleus propulsus starts to bulge out. And as it does, it can press down on a spinal nerve. Now when it does that, it can cause the spinal nerve to become inflamed, which results in numbness and tingling to whatever muscle the spinal nerve was going to. So a lot of times when you have herniated discs, and you can see right there the nucleus propulsus is bulging out and pressing on that spinal nerve, you'll have numbness and tingling in certain muscles, or it might be incredible pain, or it might even be to the point where the muscle doesn't work, where you aren't able to move. So this can be kind of serious. The causes are usually some kind of trauma to the spine. It's often from lifting something very heavy very quickly, or it could just be from the normal wear and tear. If you happen to be, for example, someone that loads packages for UPS, that constant wear and tear on the spine could cause a break in the annulus fibrosus. The same activity done over and over, as you get older, the discs dry out, and so again, there are many different causes. The treatment for herniated disc is usually rest, physical therapy, absolutely, because what you're doing with physical therapy is you're building up the muscles that strengthen the joint. So building up the muscles, perhaps stopping the activity that caused the problem in the first place. Anti-inflammatory medication will cut down on the inflammation. Steroid injections, steroids are anti-inflammatories, is the next step up, usually after physical therapy. And if all else fails, surgery. So that's the end of this video, where we've talked about hormones that are involved in growth. We've talked about fractures, different types of fractures, and then the herniated disc.